actually see a real live stem cell transplant into a patient. But before we do that, let me explain the stem cell collection procedure first, because they got to get the stem cells from somewhere. Well, first, the stem cell is an amazing thing, and they can use it in many different areas. When a stem cell is collected, the donor has it's basically a loop. They draw the blood from one arm or one side of the neck and then run it through a machine, and it separates the stem cell from the rest of the blood, and then they put the blood back into the patient. And it is a 1 to 2 day procedure. And after it's been collected, they freeze it and then use it at a later date.
Oh, I thought you were like reading instructions.
No. You're like, what are you doing?
I know.
I know what I'm doing, I swear. All right, we can take the masks off. I'm gonna give you your pre-meds real quick. So that includes the Benadryl, which will make you, sometimes, for some reason, some people don't get drowsy by it, which I'm just like, whoa.
Yeah, gonna knock me out.
Yeah. So I'll just go straight through this guy. There are 3. So you're going to get some Zofran for nausea. And you're getting, I just pushed hydrocortisone, which is a steroid, which is like what's the word? Reaction. Prevents reaction. Same with the Benadryl.
It's amazing how quick that comes to, and you get it all the way in your taste buds, you know?
Right.
Yeah. Taste it right I can still taste it. They had coffee. Well, this is nasty. Oh, was it too sweet or too bitter?
Their decaf is kind of
Oh.
yucky tasting to begin with.
Yeah.
Their donuts are good.
What's up? The Benadryl?
Huh?
What do you mean you don't feel well?
It's going to your head. That's the flush you're putting in, right?
Yeah.
Oh, right. Okay. That's the last one?
Mm-hmm.
Okay.
Do you feel nauseous?
Okay, cool. So the stem cells are gonna go hopefully on this hook, and then we're gonna connect here. You have just a bag of saline. They're gonna go through to the filter. There's gonna be a lot of clamping and whatever. So I'll just pull it up through this syringe, and then this guy right here, as you can see, can go up and down. So it's just gonna push it through the tubing, which will be connected to this tubing, and then it just goes through our central line.
Okay.
So that's how it works.
So you don't unplug the anti.
So the
That's all
central
gonna be
line
fine.
is located right in the ventricle of the heart, right?
Right before it hits the top of the heart, the atrium. Yeah. But yeah, it's in the heart. Mhm.
So right there. Okay.
Yeah.
So it gets mixed up good.
Just before it enters the heart. It's not like in the heart, but just before it enters.
You don't actually physically push it in there, do you?
No,
Or
this guy does that for me.
Oh, okay.
I set the rate, and then that's how it.
Is that like
pushes it in.
super precise or something?
Well, yeah, you have to set it for like 300, 200, whatever, and then set it accordingly. So if she starts feeling weird, then I'll usually do it slower. If she feels fine, then I'll do it a little bit faster.
Is faster better if she's feeling okay?
Yes.
I mean, we prefer that she feels okay, but
Yeah.
I mean, it's not uncommon that something might happen. I mean, you might feel weird.
Okay.
So,
What do you mean? When?
like, some people just feel nauseous or whatever, but we don't plan on that because you got all the meds and stuff going, the free meds.
Cindy, do you want your cells blessed before you?
I asked her that already. Yeah.
Oh, we've got about 500 people praying. They're blessed.
Okay, good.
Okay.
All right.
Thank you.
All right.
So, that's about it.
Oh, sorry. Cells have arrived.
You got them in the. You don't mind me filming, do you?
No,
Good.
it's called a dry shipper. We fill it with liquid nitrogen, and it absorbs into the walls, and it's at like negative 300 Fahrenheit.
She's doing the dishes.
Yeah.
First things first.
That's right. Is that ultrasonic or just?
So, this is a water bath that we warm the water up to 37, like body temperature.
Oh, I got that.
The cells will still be cold. That's what we
Minus 300.
do right now.
And they'll stay that way for like ever? Okay.
Till I thaw.
How do they freeze them? I mean, what's the process? Is it real slow or
It
is it real
takes
fast?
about an hour. We have a controlled rate
There's a lot
freezer. It's
going on.
actually a small box.
Mm-hmm.
And we use, it's basically kind of like a fan blowing up liquid nitrogen that freezes them down to freezes them solid. We use a lot of liquid nitrogen.
I know what I'm doing, I promise. Okay. Can I have your name and birthday? Sorry.
Put all the patients through this. Cynthia's 160.
Alright, I have Cynthia's Scriptsmeyer, 6/11/1960. And MRN is 700-898-647. Perfect.
This is the coolest part I do.
Yes.
Big old gloves.
Looks like a science experiment.
Yeah.
You do look like a scientist. Now you need the safety glasses and we're all good.
My credentials is
Minus 300 degrees Fahrenheit. Wow.
Yep.
So now that's room temperature or body temperature?
body temperature. It's around
Okay.
37 Celsius. This is so they don't break.
Yeah. No, it's not.
This is the actual bag.
Yeah.
Actually really small.
There it is.
It's a lot of work for such a small bag.
Yeah.
Okay. I'm thinking like the.
I'm thinking the cost per ounce of that. Never mind. So how long does it take to, about like 5 minutes to thaw or something?
Usually around like 3. Not too bad.
Because it's pretty.
This is a pretty big bag though.
Yeah. Oh, it is? Or not?
They range from like 40 milliliters to around 90. 90 is probably the highest we go. It's about 75.
How big is that bag?
75.
Oh, okay.
2 bags of 75 milliliters. And she's getting 8 million.
Oh, 8 million?
Mm-hmm.
Oh, okay.
4 in each bag.
Gotcha.
Yeah, we just massage it until it. So until there's no ice crystals, we use a preservative that it replaces. It takes the water out of the cells
Mm-hmm.
and replaces the water with itself. Because I mean, like you know, how ice expands when.
Yeah.
So we don't want to break the cells.
Oh,
So
okay.
that's why we have to use the preservative. Keep the
So
cells
you're getting,
intact.
Cindy, you're getting preservatives.
And supposedly it smells like cream corn.
Yeah. So
I
the
never get
preserv-
close enough to smell it.
So the preservative in the bag, the way we break it down is through our breath. So we like to keep you talking, kind of help break it down some more. And what can happen is it starts to smell like cream corn. Like your breath literally starts to smell like cream corn. You may not be able to like taste it or smell it, but we can. So sometimes people will walk in and they're like, it smells really sweet in here, and that's why. All right, I have Cynthia's 700-898-647, donor pool 17598, bag 1 of 3. Patient is B positive, donor is B positive. Perfect. Is there anything else I need to say? Okay. Cool.
Is my name on it?
It sure is. Make sure I get through it. Okay. Beautiful. Okay.
So people play like really obnoxious music too, or anything?
No, they play like Josh Groban, like You Raise Me Up. I've heard that before. They'll play like some pretty awesome gospel music. Yeah.
One infusion I was in, the guy played the little like Game of Thrones soundtrack.
Is that it? Here they come?
Yep. So then my next step would be once the cells.
Can you sing something for it? No, I'm kidding.
Once the cells start to hit her is the time that I would tell her stem cells started infusing at such and such a time.
Okay.
And then once I press pause, then I tell her that time as well when it stops. So you can see the little bubble right there.
Yep.
So that's what I'm going by.
Which line is it?
You follow in until you see
Here,
the red.
this one.
It'll come
See,
through.
here they are.
Here they come.
That's not blood.
Those are the stem cells.
Oh, they're not red like blood?
They'll eventually get darker.
Hmm. Oh, yeah, because...
Alright, so 15, 18. 15 or 3, 18.
Now, does it keep drawing from that bag? Or do you have to
Yeah, I have
pull the
to-
plunger
I-
again?
Yeah, I have to completely empty it.
So you use that plunger again and
Mhm.
draw it out of the bag,
Yeah,
and then
I flush it a couple times. Well, I flush it once between each bag too.
I gotcha.
This bag. Yeah.
Oh, ugh.
Taste it?
No, but I can smell it.
No. Yeah.
Oh yeah, I got it from the first whiff.
Look at this. There it is.
Run to May.
There you go. I'm smelling
Cream corn.
Maybe Brenda smells like corn.
Everybody just stares at people during this process, and I feel like, oh, I'll not add to that. All right, if you could just page you and just hold down, let me know
Sure.
if you're feeling okay.
Yeah.
Anything I can do for you otherwise today? Okay, good. We'll have an uneventful night, and we'll see you in the morning, okay?
Okay.
Any questions I can help answer for you, sir?
No, all good. Thank you.
Very good, nice to meet you.
So, oh, okay. So you've got three pouches of them. Okay.
Yeah, but we're from that specific collection.
Yeah.
And we're giving her 2 of them today.
Yeah. And then the third one I take it is probably smaller than the.
I think it's the same size.
Oh.
Let's see. Just let that.
Just 2.
Oh, you're right. it's 37 milliliters. The last one.
Okay.
We put the first 2 bags in 4 million, and the last one is 1.97 million.
All right.
So that one's empty. And then now that the bag is empty, but the syringe, the gigantic syringe, is not. Yeah. And then that machine pushes it down real slow.
Oh, I see.
Yeah. That's how I pull it up out of the bag.
Oh. So it's not really empty.
So that's bag 2 and it's ready to go. Okay. Neat.
I have Cynthia Spritzmeyer, 700-898-647, donor pool 17598. Bag 2 of 3, patient is B positive, donor is B positive.
One last check. Cindy needs to look at the bag. See your name on there?
It's smaller. It's
Brenda.
It's right there.
Oh, her name is on it.
Yeah. So that's just water dripping from the bath. Okay. Now we just gotta wait for this guy to finish up.
So you close that one, you open that one,
Open this guy.
you open that one. There it goes. Now you draw it in. And you open everything back up. So why would she feel hot?
Oh,
97.
perfect.
Oh, good. Okay.
And just like a flushed face can be a side effect, but just want to make sure it's not a reaction, which is not. So
That's what I thought. I thought I read that in that book. That the flush face.
yeah, that can happen. Just want to make sure it wasn't a sign of something else.
Yeah. Lots going on.
what I mean.
I'm just teasing. Keep to yourself, go about your business.
Yo.
Multitasking.
Yeah. Yep. Nah. Oh.
Yeah.
No, I don't know. Hold on. Sorry. I'm like. Do you have another one here too, or no?
No.
Oh, okay.
But I can get the end time off power chart.
Oh, okay. She does not have another one to go to, so I don't know. I'm not sure. Okay. Right, bye.
We have a phone here over there. The other part is missing this whole part. So it's really hard.
Hey, your phone matches.
Yeah.
It's perfect.
I have to figure out what time I'm thawing everything. They're probably upset with me because I have the good part. Yeah, not the other part.
All right, 347.
Okay, well then I will go figure that out.
Okay, let me ask
Wait,
what
what's
patient
on
it is.
Okay. I'll grab your signatures. And then I will
Sure.
So that's the last of it.
I might do one more flush just to make sure
Mm-hmm.
get all the pink out of there.
Yep.
Or the major.
Okay, so now we're at, we ended up with the, emptied the bag.
We emptied the bag, so now we're just flushing. As
Flushing
you can
the
see, it's very
lines,
light
yeah.
in color, so that
Yep.
means there's mostly saline in there, so we're just flushing the rest of them through. And then
Back
after
through.
that, we will be done.
That's it. Okay.
And that is it.
And the saline comes from the.
Oh, sorry, it's
Bag.
behind this
There
bag
it
here.
is.
Yeah.
Okay.
Yep. So,
Very good.
yeah.
Well, thank you so much for
You're very
administering all the goodies for Cindy.
Alright, Cindy. Well. Yeah. What's that?
There's some left in here?
Yeah, because I can't clamp it all the way to.
So then that's just like the bag of saline,
Mhm.
Yeah.
and then now it's all clear.
Right.
And
That's all in.
that's it.
That's it.